I am Dr. Siva Sivappriyan and I work at One Ashford Hospital and I also work at Maidstone and Tunbridge Wells NHS Trust. If you have been told that you have diabetes, the first thing is to find out what type of diabetes you have. If you are overweight and if you have other medical problems like hypertension, you may well have type 2 diabetes. If you are young and don't have a weight problem, you may well have type 1 diabetes. There are other uncommon forms of diabetes like pancreatogenic diabetes or congenital or familial diabetes. The most important thing is to find out which type of diabetes you have, as the treatment will differ depending on the type of the diabetes. The good news is there are a lot of investigations we can do these days to define and find out what type of diabetes you have. It can be quite upsetting moment for you to hear that you have diabetes, but the good news is there are a lot of treatment options available now for us to normalize your blood glucose. The most important thing is to go and see the diabetes doctor or nurse to have a comprehensive health check, as your diabetes can also affect any parts of the body. Your doctor may also do special blood tests to find out whether you have any other medical problems associated with the diabetes. And then we'll talk about treatment. The treatment will be tablets or diet change to reverse your diabetes up to an extent, or sometimes we also have to think about giving you insulin treatment to improve your blood glucose. Your doctor may also will refer you to any education program for you to understand and learn to live with diabetes, and your doctor may also will refer you to see a dietitian for specialist dietetic advice. But the most important thing is to follow the advice and you will be able to control the diabetes and have a normal life like anyone else. It is a current worry everybody that whether we will get COVID, and we know for a fact if you have diabetes, especially if your diabetes control is not good, your chances of getting COVID infection is high. That proves the case that you will need to look after your diabetes and try and improve your diabetes. You also need to wear appropriate protective measures and follow appropriate protective measures to prevent any COVID infection. You also need to be vaccinated, and if you have any concerns about you having vaccines, it is important for you to discuss that with your doctor or nurse looking after you for your diabetes. So the weight problem is so common these days, and the first thing is to see the right specialist or nurse to find out whether you will need special test to look for any underlying causes for your weight problem. There are treatment options available, and the treatment start with lifestyle changes including dietetic advice, but also nowadays we have special treatment available including injections you can take yourself at home that will help you to lose weight. Again, the most important thing is to seek help. Some patients with thyroid problems can have continuing problem with their symptoms or their levels, which can go up and down. This can be related to the underlying thyroid problem or can also be related to other associated medical problems with the thyroid. So the first thing is to have a full comprehensive review of your thyroid problem. We often do special blood tests to find out why people have thyroid problem not being controlled. You also may need extra blood test to find out any other associated conditions like vitamin B12 deficiency, vitamin D deficiency, any other hormonal problem that can be also associated with thyroid problem. Once you have those investigations done, there are possibilities for us to fine-tune your thyroid medications and even consider other alternative thyroid medications to control and keep your symptoms under control. If you have any questions about any of these medical conditions I talked so far or any other hormonal or diabetes related problems, I am available at One Ashford Hospital, and feel free to book an appointment with me, and I would be happy to review your case and give you the right advice.